A new report commissioned by the Canadian Medical Association is providing a stark look at some of the pandemic's impacts on Canada's healthcare system. To talk about the findings, I'm joined by Dr. Catherine Smart, who's the president of the Canadian Medical Association. Catherine, thanks so much for doing this. But one of the constants across the country throughout this pandemic has been overwhelmed hospitals. And one of the key findings from this report is actually showing an increase in deaths unrelated to illness from COVID 19, right?
Absolutely. We looked at a period from August to December, so about 5 months, and we saw there was 4,000 excess deaths over what we would normally expect in our population that weren't attributable to COVID. And what we've determined from that is these are likely people who were unable to access care or had significant delays in their care that ultimately led to their death. So this is a really concerning statistic, and I suspect that we're going to see this continue throughout the pandemic until we can get our healthcare system back to functioning.
And the report also identifies an increase in opioid related deaths to nearly 20 a day in the first 3 months of 2021. So I was just wondering what else this report contained or uncovered about addictions in general.
Yeah, as you said, we saw a huge increase in the amount of people dying from substance use. I think that's on the backdrop of worsening mental health and isolation, of course, across the country. Unsafe drug supply is a big contributor. As I think we know, fentanyl is now commonly in the drug supply, and that's often what contributes to these overdose deaths. It's obviously really, really concerning. Certain provinces have been impacted more dramatically by this. And these are often young people who are losing their lives, often people that have struggled to seek care for perhaps an underlying mental illness or trauma or other things in their lives that have led to the substance use. And I think it really just speaks to the crisis we have in mental health care across this country and a strong need to destigmatize drug use and provide safe supply and get people the medical care they deserve who are struggling with addictions.
And among other findings are that two-thirds of Canadians living with chronic health conditions actually reported difficulty in accessing the healthcare that they need. So, with that, as well as everything else that we've discussed, what kind of response do you think is required at this point to get things back on track?
I think it's really challenging. Right now, of course, today we're hearing a lot more about the Omicron variant and what is that going to mean for Canada. Right, I think as we're getting to excellent levels of vaccination and we're anticipating sort of building back and really wanting to start to look at some of these issues in the system. How do we get the system back on its feet? How do we get people accessing care again, which is, as you stated, for people with chronic illness was a real challenge during the pandemic. I think the path forward right now is unclear. Are we headed into more lockdowns, more restrictions? We don't know yet at this point. I certainly hope that's not the case, but I just think it's too early to tell. We did see a huge pivot to virtual care, which has, of course, been so important in keeping people connected with their healthcare. And I think we're getting better at using it and we're starting to understand it better. But it isn't always a substitute for in person care. And I think for people dealing with significant chronic disease, how to best use virtual care paired with in person care is something that we're still needing to understand.
Those are all the questions that I had, but is there anything else that you just wanted to communicate to the masses quickly before we say goodbye?
I think what people should really take away from this report is that we have a health system in crisis, and it's really time for governments to come together. We need to unsilo healthcare. We need to collaborate. We need to move towards actual solutions. We've been talking about the healthcare system for a long time. We have many reports telling us about how it's not working well, gathering dust on shelves. But now is really a time for action. And I think this report really lays bare the broad impacts of the pandemic and what Canadians can expect if governments don't get serious about solving these problems.
Thanks so much for doing this, Catherine.